Welcome to Living a Fulfilled Life podcast,
a weekly podcast on mental health awareness, everyday living, and just plain old feel-good conversations about how to have a fulfilled life from our perspective.
We're your host, and my name is Famous Irwin.
And I'm Lakeisha Irwin, and we are licensed psychotherapists who
work together,
build together,
live together,
bomb chicka chicka boom boom, and heal the world together. Please know that the content here is for informational and conversational purposes only. Because each person is unique, please make sure that you consult a healthcare professional before making any changes regarding your mental health needs. This podcast is not meant to be a substitute for mental health treatment.
Please join us as we have simple, real conversations about mental health and life.
We are looking forward to see how you hope, grow, and achieve a fulfilled life.
Hello there, this is Famous and...
This is Lakeisha.
Hey Lakeisha, how are you?
I am doing well. And how are you all doing, podcasters out there in podcaster land?
Podcaster land, how are you? We have a great topic today. It's a topic that many people just have questions about. Sometimes they hear these different terms as far as who can do psychotherapy. And so we're here today just to clarify that for you, so you have a good understanding when you go see a healthcare provider, and you would know if this person will or is capable of providing the services that you need.
We really want to get into this because we get a lot of people that ask us, what does a psychotherapist really do? And how long do they have to go to school? And can they prescribe medication or not? We get so many questions about it. We thought that it would be a good idea, as we're in the beginning stages of this podcast, to really share some of this to everyone.
Awesome. And so just starting off with your highest level, we're going to start off with your medical doctors can be psychiatrists. Mm-hmm. Medical doctor take at least 4 years of medical school, and then afterwards they'll go into a residency specializing in psychiatry. There they get all the skills they need. They learn about evaluating, diagnosing, and also how to treat patients with medication if necessary.
So when we're talking about a medical doctor, right, they're going to specialize in a different area. So this particular doctor, when we look at a psychiatrist, they decide to specialize in the field of psychiatry. Mm-hmm. All right. Now, it is important to know that every MD or every general practitioner is also having some knowledge about psychiatry or behavioral health, but it's very minimal. And so this is why it's so important that if someone has a child or has a minor and they're going to see a pediatrician, that pediatrician actually can prescribe medication. We literally had a situation with our pet, and our little pet Yorkie took her to the doctor, and they were able to prescribe some medication for them. So It's not so much that they can't prescribe it, but it's about being with someone who has an increased specialized care.
Exactly. And so every person who is an MD, they go through different rotations. And within these rotations, they may focus on psychiatry. They may focus on pediatrics. They may focus on family practitioners. They may focus on general. And so they go through these different rotations, and that gives them a highlight of what they may want to specialize in. Therefore, they do their residency in psychiatrist.
Right.
And it's a more focused curriculum for them. They do rotations, they do internships to get more specialized. And because we are mental health therapists, we are talking about the psychiatrists. There are other MDs, but we're more specifically talking about psychiatrists.
Yes. And knowing that these individuals, they can prescribe, again, they can also provide psychotherapy as well. In our experience, we have seen more that really do medication management. So they may meet with the client just for a few moments. They're not getting deep into therapy, but it does not mean that some cannot get into talk therapy where they're also prescribing.
Next, what we have?
Psychologists. So, I want to say that when we started talking about the terms, psychologist was one of the main reasons why we were like, we need to do this, right? Because so many individuals are confused about psychologists and psychiatrist. Those are the big
Yes.
things. And then you throw in psychotherapy and they're like, what are y'all talking about? And so I think that this is why we really wanted to make sure individuals were clear. So not only they know who they're talking to, but they understand the why behind it. So podcasters, please know this is why we talking about this.
Yes.
We want to make sure that you are aware of the why behind the what. Famous?
Exactly. The why behind the what. I like that. And so let's look at it this way. In your psychologist, there's different kinds of psychologists. A PhD, one is a PsyD. Your PsyD is going to be more clinical. They're going to do more therapy. Your PhD are going to be a little more research oriented. They may be professors or things of that nature, publishing books. And so there is a difference. Both are trained as psychologists.
Right.
One just emphasizes more on clinical.
Now, depending on where they're at, not everyone can prescribe, but both can definitely provide psychotherapy. So both can provide counseling.
Psychotherapy assessment. A lot of your psychologists, they'll do a lot of testing. You'll see that they work in the school system. And so they do a lot of those things. And the thing is, and every state is different. Every state is different. Some psychologists can prescribe medication, but every state is different. So if you're in a state and you want to have a psychologist over a psychiatrist and you want medication, you would have to look into those state laws and see if that's appropriate for you.
Yeah, it's definitely going to be different in each state. In our state, primarily, no, you are not going to find a psychologist that does prescribe. Most psychologists focus more so on behavioral patterns. So they may be doing research on anxiety, like tracking sleeping patterns, panic attacks, things of that nature, maybe negative thoughts as well, levels of the anxiety. But it's more of the behavior that's going to be the focus versus on prescribing medications. So again, it depends on what you are seeking. Both of these, PsyD and a PhD, are going to go by that name of a doctor, just like your MD. But again, it can be confusing, and that's the reason why we really want to iron this out.
Yes.
I
think the biggest thing there is MD, medical doctor.
For sure.
Medical doctor, psychiatrist, medical doctor. These are men and women who actually passed their state boards. They've been classified, certified as medical doctors.
Right. We thought that it would be relevant for us to also bring up ARNPs and PAs. So again, we know we're coming out with the A, B, C, D, E, F, G, H, I, J, K. We know we're coming out with all of these acronyms and all of these letters. It can be confusing when you are out there in the world and you're trying to figure out what is going on. And the reason why we wanted to make sure, again, that we iron these out, that we put some heat on this so we can really make it plain Jane. We don't want people to get lost in the sauce. Lost in the sauce. But the reason why is because we understand that some individuals will look at all of these letters and they will say, I ain't gonna do it. I ain't gonna do it. It's too much. They will say, I'm not gonna reach out because I don't know who I can reach out to. And so this is really one of the main reasons why we are doing this.
Yes, exactly. And so for your ARNPs, those are essentially registered nurse practitioners.
Right.
Same training. If they go into the psychiatric arena area of their studies, then they are registered nurse practitioners for psychiatry. You also have your PAs. And again, these registered nurse practitioners can go into any one of these medical fields. They can become, they can work in the field of psychiatry, the field of family practitioner, the field of surgery. Any of these fields, they are able to participate in those. A physician assistant is, as it says, it's an assistant to a physician.
Right.
Now, a lot of times they work hand in hand with their doctors, especially in the, what I've noticed in the field of family medicine and the field of general practitioners, they're pretty actively involved. A lot of times their physicians really trust them because they're pretty good at what they do. They're also very good. A lot of times you may walk into a doctor's office and they say, hey, my name is da-da-da. I'm your physician assistant. I work with Dr. Such and such. I will going to give you the same care that he or she will give you. And so you're comfortable in our hands.
A lot of times you're going to see these individuals, ARNPs and PAs, and ARNPs can prescribe medications. A lot of times they are going to also go by that title as a doctor as
yes.
well. Your PAs are a little different. They can prescribe, but not independently. So that's going to be more so under someone else's supervision.
Exactly.
Now, as far as psychotherapy, it's a little different because normally in most cases, you're not going to find either one of these providing psychotherapy or counseling, but it's not unusual if one were in the state of Florida.
Okay.
So next list, and this is our list that we love. We're getting into our jam. Yes. And why are we excited? Because we are talking about us.
Licensed mental health counselors, also known as psychotherapists.
Absolutely. If you're driving a car, keep driving. Okay. If you're washing the dishes or if you're vacuuming, just pause for a moment so you can really hear this. Like take a few seconds to really hear what we're saying.
I'm excited. What are you going to say?
Are you excited? Okay. I wanted you to pause because it can be very confusing, the next alphabet of letters that we are going to really ramble out. Okay. So we know LMHC. Licensed mental health counselors.
Yes.
And we're talking about in the state of Florida. That is the board, the area, mental health that we operate under and that we are licensed in. However, you also have your LMFTs, okay?
Licensed marriage family therapists.
Licensed marriage family therapists. Then we also have
your licensed clinical social workers.
LCSW.
Yes.
Okay.
Now, you'll see a lot of your LCSWs working in the hospital settings, working in the community settings, because they do a lot of social work as well as psychotherapy.
So all of these are different, okay? But when we look at each of them, and then we're going to
break them down
a little bit more. But so here's what we have: LMHC, LMFT, and LCSW. Mental health, marriage and family, and clinical social work, okay? All of these in this category can provide psychotherapy. So as Famous was saying, you're going to see, not all of the time, you will see a lot of your clinical social workers working in the hospital. I see quite a bit working with Department of Children and Families, also in the schools. So it's a variety of that. Of course, you will see your LMFT, your marriage and your families, doing a lot. I see more in private practice. Exactly. And then mental health is very versatile. In fact, I know when we talked about this, when we were deciding what area we were going to go into, part of the reason why I chose mental health counseling is because of the flexibility with the license. What about you, Famous?
It's really interesting because in the state of California, and I'm from California, it was really geared towards licensed marriage family therapy. When I moved here to Florida, I didn't see a lot of that.
Yeah.
I saw a licensed mental health counselor. And so I really didn't know that existed until I got here in Florida. And so it definitely fell in line with what I wanted to do. However, if I still lived in California, I probably would have became a licensed marriage family therapist because it was more prominent there. Yeah. And so just by the awareness of licensed mental health counseling here in Florida, that's what I gravitated towards.
Absolutely. And again, they all do similar things. Now, if we were talking about credentialing for insurance and if it's Medicare, Medicaid, it's very different depending on what it is. But for the most part, it is the same. Now, let's talk a little bit about what that means. We know all of them can provide psychotherapy in the state of Florida under the Florida Department of Health. So it might be clinical social work, marriage and family therapy. It might be mental health counseling. And that's really the credentialing and the regulating board that supersedes all of these areas. So all of these areas do have to obtain their master's degree as well as a practicum. Remember your practicum, Famous?
I
do.
You
remember your practicum?
I do.
So what is a practicum?
Thanks for putting me on the spot, Keisha. A practicum is basically you go there, you have classes, you will start seeing clients, however, under the supervision of a licensed supervisor. And you're accumulating hours to show that you are able to perform as a therapist. However, you are definitely being supervised. So any decision that is made would typically have to go through your supervisor, and you do supervision with your supervisor. and then you can go sit for the licensing.
It can take 2 to 3 years, and it depends on the actual hours. So you're going to do it at a site that has been approved, but then after the approval of a site, then you have to complete so many hours to become a registered intern.
Yes.
So you do that with the state. It has to be signed under that licensed professional.
Mm-hmm.
It has to be approved. There's so many individual hours, group hours that need to be complete. Then on top of that, there's a lot of trainings that you also have to complete with the state. So everything from HIV, domestic violence, CPR, first aid. And then there's also continuing education that has to be done so many years depending on when you get registered. But I'm saying all of this because there is a lengthy process. Oh, we ain't even talk about the exam, right?
Yeah, exactly. And every year to 2 years, it was really beautiful about the state is they want to make sure that you're staying informed on the changes in mental health counseling. And so you have to do CEUs and you have to take so many hours of that. Everyone who is a licensed practitioner, they definitely stay up to date on what's happening in that field.
And it allows therapists to, as Famous said, to be up to date on everything because things change. They change over time and making sure that we are up to date. Next, we have our counselors. And we thought this was very important because we hear the term counselors like all the time. It might be a pastoral counselor. It might be a substance abuse counselor. It could be financial counselors. It goes on and on. Healthcare counselors.
Daycare counselors.
Yes. Everywhere. Academic counselors. Did I say that already?
No, you did.
I didn't say that already. There's so many counselors, right? Credit counselors. There's counselors for every. Do they call people who get their hair done counselors?
No.
No?
But some of them want to be counselors.
Yes. Well, some of them can be counselors
Exactly,
too.
because
Right.
people are always sitting in their chair and they're always leaning in an ear.
They actually take at least one course for counseling, believe it or not.
Really?
Just some general counseling,
I didn't know
absolutely,
that. That's
because they have people in their chair. Yeah, I can't remember whose chair I was in when they told me that, but it happens.
Some of your attorneys, they're also called counselors.
Yes, I
Right.
mean counselors, exactly. Counselor.
Yeah.
Think about it. Yeah, when they're attorney, it makes sense.
You just had an aha moment,
I
Keisha.
did. Well, because I was thinking. But at any rate, when they say, counselor, may I approach the bench? Right?
I guess so.
Right?
I don't watch a lot of Law and Order. so I'm
Oh,
not really
come
sure.
on. Dun, dun, dun. No, that's not. It's dun, dun. Listeners, podcasters, Famous is looking at me in a very odd way right now. And if you know what I am talking about, the dun, dun, the bing, the bong from Special Victims Unit, from Law and Order, from all of that stuff. If you know what I'm talking about, please make sure you drop some comments.
Okay.
Please make sure you let us know. This is how we figured out.
Clarify that because I don't watch Law and Order.
No, he doesn't. But has
So
anybody out there watched How to Get Away with Murder? Annalise Keaton, if you know what I'm talking about and you understand why the counselors had to approach the bench at certain times, please make sure that you send something out.
Validate
to
her,
us.
y'all. Validate her.
There's so many different types of counselors, right?
Much needed too.
Absolutely. And the thing when we talk about counselors, it is important to understand that counselors' education, their experience, and their focus. And the reason why this is important is because if you are desiring to see a counselor for, say, trauma, it is important to make sure that counselor has the credentials and has the expertise to carry you where you need to go. And again, this is part of the other reason why we're getting into this.
And that's specializing. Again, every counselor may have their niche,
Right.
Some are very effective working with depression. Some are effective in working with anxiety. Some are very effective in working with trauma, and they get special training for that. And so if you have a specific need and then you want to find that counselor that's going to be specialized in what you are interested in working on. So that's very important.
For sure. So next we thought that it was very important for us to talk about this last area. And this last area is that of life coach.
Life coach.
Take it away, Mr. Fame.
I really became familiar with life coach by watching one of the television shows. I'm not really sure if we could be naming these different people, so I don't know about
All right, well, let's
legal.
not.
Maybe I need to go talk to a legal counselor about that. Okay.
Dun, dun, dun.
But
no,
we
wait
watched
a minute.
this.
Dun, dun. How do I do it?
I don't know.
That's it. Dun,
I don't know. Maybe we got to find it and
okay,
implement
I
it.
can. Dun,
Okay.
Okay.
All
All right. And so anyway,
That was a
so
joke,
what
everyone.
I've learned
Do you
about
see what we
life
did?
counselors,
Do you see what we did there? That was a joke.
life counselors are people also who are in the helping profession.
For sure.
They have a skill set where they are able to provide a client with some direction in life. Maybe it's goal setting. Maybe it's how to find a job. Maybe it's how to lose weight. Maybe it's about organization. So they really do help their clients who are in need of those services. A lot of times there's a stigma for some people where they don't want to see a psychotherapist. There's that stigma there. And a lot of times I've had clients say, I really want a life coach. Because a life coach for them just sounds a little easy. It's motivating. I got a life coach. I got a
Right.
coach, someone who's training me, someone who's teaching me. And so that stigma is removed until a person really sits down in front of a therapist and say, wow, this is really good too. And so some people have a life coach and a therapist, you know, and they work very well hand in hand for the individual. It all depends on what they're looking for.
Yeah, it's all about the need. I have several clients that do both. So they might see me for therapy, but they may also have a life coach. And so one of the things we like to say is that therapists focus on why. So the why behind the what, as we were saying before. But a lot of life coaches really focus on the how. So they're going to talk about the method behind, you know, how to be able to get here. So if someone says, hey, they want to change career goals or fields per se, as a therapist, we may dig deeper to explore what purpose and passions the individuals may have and why, and help them connect dots between that.
Exactly.
The actual life coach may actually assist them with maybe some resume writing. They may assist them with, hey, this is how you're going to go and perform for that interview.
Exactly.
Let's do some interviewing coaching. So this is how we all really
Yeah.
work together.
And with your life coaches, they are not trained in therapy or psychotherapy. And so they are not able, or they don't have the approval to do diagnosing.
Right.
And so that's one of the major differences too. They're not able to diagnose. Okay.
Well, there's a big difference between coaching and therapy, and
Yes.
both of them definitely have their place. We work with a lot of life coaches. So if anyone ever needs referrals for that, we absolutely have close friends, colleagues that also do life coaching as well as therapy. But it depends on what you all are looking for.
What your needs are.
And that's the thing with all of these terms that we've talked about, right? The first step is going to be to determine where you're at and what it is that you may need.
What are your needs?
What are your
Exactly.
needs? And when we understand what your needs are, or when you understand what your needs are, then you can take the next steps
Right.
to meet one of these providers. And we always suggest that you look at what your insurance, if you have insurance, of course, look at what services may be available for you, and then start looking at one of these behavioral health providers.
Yeah, we'll come back to psychiatrists. A lot of times a client may go to a psychiatrist and they may seek medication for whatever reason. A psychiatrist typically will say, well, listen, I really want you to get therapy. I really want you to get therapy before I give you this medication. I'll have therapy 4 to 6 weeks, come back and see me. And if you're in the same place, we can talk about what would be the best medication for you. Because a lot of times clients will go in there not really knowing what they need.
Right.
And so they will be referred to a therapist, and a therapist can work through some of those issues. If it's anxiety, they can work through those issues. And for some reason, if therapy alone is not doing it, then it really does help to have medication.
And we're the same way. If someone does need any type of psychiatric services, we definitely want to provide referrals for that, as well as if it's meeting with their general practitioner for any kind of medical care as well, because the collaborative approach is really what we need, whether it's take a village to raise a family or a village to assist and support individuals towards reaching their mental health goals. We hope that you were able to obtain some information from this. If you are not in therapy, or if you're not working with any one of these treatment providers, give it a chance. We want to encourage you to get out and to connect in some way.
So this has been an exciting 25, 30 minutes and very informative. And so hopefully you're able to take some notes, and we'll talk to you in the near future.
This is a fulfilled life, and we can't wait to see how you hope, grow, and achieve a fulfilled life.